next, stage of the event, I will be inviting no other person, but the same person that just finished the moderation of the last panel session, in the person of Mr. Tokunbo Smith. He has a very brief time of presentation, and of course, your time has been eaten up too. So I give you the floor now, sir. Thank you.
Good morning once again, ladies and gentlemen. Actually, with my keynote address, I'm only going to the key areas and the key points which I think the society of telemedicine need to know, the government need to know, the private sector need to know, and all those who are on this program, so that they can know exactly where we are going. It is very delighted for me to be here this morning as one of the keynote speakers of Nigeria Telehealth Technology Summit 2023. It is a great honor and privilege to be called upon to give a keynote address at this crucial time in our nation. The topic: accessible and affordable healthcare services, utilizing technology, governance, and society. Healthcare delivery in Nigeria has faced major challenges towards achieving universal health coverage, while significant progress was made in the first 2 decades after the country's independence in 1960. The economic downturn resulting from one plummeting of oil price, of which Nigeria was dependent, led to a series of twists and turns in the health sector. Health policies were subsequently influenced by external forces. There are so many external forces that influence health environment as ecosystem. And the adoption of the structural adjustment program signaled a shift from predominantly a welfare scheme to the introduction of user-free and the resultant proliferation of private healthcare provision. One thing we should know is that there was a time in Nigeria we had structural adjustment program, and that was during the period of former head of state Ibrahim Babangida, whereby structural adjustment program had to come in. And because it came in, a lot of hospitals were not giving free services anymore. So we had to resort to private healthcare system, whereby you have to pay some fees to be able to benefit from the healthcare ecosystem. And that has caused a lot of problems for us. But that made government to reject their functionality as healthcare provider in this country. Health policies in Nigeria have undergone tremendous evolution in the just past 60 years, but without the desirable quality of healthcare delivery system in place to advance health status of Nigeria. While successive governments have made concerted efforts to promote health equity and ensure unrestrained access to health services, majority of the citizens are still grappling with various health challenges. There are a lot of challenges going on because the government cannot cope anymore. This is a time in our nation that accessing healthcare facility is becoming difficult for everyone. We have shortage of healthcare personnel because our healthcare professionals are seeking greener pastures. It is a serious challenge for the nation to address the shortage of manpower in this industry. This is the time to appreciate telehealth because technology will play a vital role in healthcare. With the advent of electronic medical records and electronic health records, telehealth will be more pronounced. Is the work of our healthcare professionals thereby be more effective in discharging their duty? Now let's look at the keywords of this topic. The keywords are: number one, accessible, which means that the quality of being easy to approach, reach, enter, speak with, use, or understand. That is, when you talk something, when you say something is accessible, it means it must be easy and free to have. Now let's look at affordability, the state of being cheap enough for people to be able to buy. You have to take into consideration the rural area people, the low income people, and so for us to have an affordable healthcare system, it means a lot in this country. The healthcare, what do we say when we say healthcare? the maintaining and restoration of health by the treatment and prevention of disease, especially by trained and licensed professionals as in medicine, dentistry, clinical psychology, and public health. Technology itself. Technology is the application of scientific knowledge to the practical aims of human life, or as it's sometimes phrased, to the change and manipulation of the human environment. Governance has been defined to refer to structures and processes that are designed to ensure accountability, transparency, responsiveness, rule of law, stability, equity, and inclusiveness, empowerment, and broad-based participation. Talk about society. When you talk about the society, we are looking at the aggregate of people living together in a more or less order community. A society can also be referred to as a group of people living together with shared cultures, technology, good governance, with shared cultures, having social interactions and interrelationship. Now, how can we achieve affordable healthcare services using technology, good governance in our society? Number one, the government should ensure adequate funding of healthcare services. The government should encourage state innovation in healthcare industry. The government should support the establishment of a permanent federal reinsurance program. They should address physician shortages. They should grow the clinical workforce by expanding the number of available graduate medical education residency slots. Expand medical schools, loan forgiveness programs, remove barriers to physical immigration for foreign-trained physicians to practice in Nigeria. Telehealth and remote patient monitoring will become an essential, cost-effective, and reliable means to expand capacity in the health system marked by significant and persistent specialty shortages and geographical disparity. Physicians should get assurance that digital health solutions are cost-effective and provide a path to payment. There should be increased in efficiency of existing workforce by instituting common sense medical liability. There must be reforms, and the government must reduce the cost of insurance when it comes to health. Technology in healthcare has provided the healthcare community with advanced tools to improve patient care. Using electronic
registered in
health
the UK
records,
on a
physicians can easily access the complete medical histories of patients and make an informed decision. When you are into EHR, electronic health record, anywhere in the world you can have access to your medical facility, and that is what the government should also much embark upon now. And not only embarking on that, but to educate and also create awareness about EHR so that the rural women, the poor people will know exactly what EHR is all about, and that they will have confidence so that they will know. And not only that, mobile phones, people can now use mobile phones a lot in Nigeria. They use mobile phones for a lot of financial transactions. So also mobile phones should be introduced into health system as well. Health system governance determines the primary objectives of a health system and the direction of policy and legislation needed to achieve this. There must be good policies on ground. Legislation must also be on ground so that we affect and assist both the patients and the health practitioners. Political institutions are responsible for seeking a compromise between the different groups in the healthcare sector while ensuring public health needs and goals are met. Our politicians, our House of Assembly, House of Rep, Senate should make sure that they look into the areas of telemedicine. They also look into the health ecosystem and make sure that they help everybody to achieve the goal by providing affordable services in the health industry. Political instability, corruption, limited institutional capacity, and an unstable economy are major factors responsible for the poor development of health services in Nigeria, and this must be addressed. We must have democracy on ground. There shall be no coup d'etat so that we can have stability in our political ecosystem. Corruption must be addressed at all levels, because where the corruption is heavy, definitely we will have problems, not only in the health, but even in the financial institution that will sponsor so many things, so that when you are applying for loan to establish a private healthcare facility, you have the loan without anybody, without any barrier. Also, I want to also make the government know that they must encourage local drug manufacturers. Excise duty must be reduced drastically or eliminated. And those areas whereby you have to import certain devices like electronic, radio, computers, and every other devices, there should be a reduction in the import duty. And this will help a lot when it comes to telemedicine.
Wow,
It
thank
is
you.
well known that today we are all having problems and challenges when it comes to telemedicine. And as so much, we want to thank the organizer of this 2023 technology, telehealth technology, that they have done so much. And I know a lot we have gained from since yesterday from the discussion so far. But thank
Thank you
you,
so
and I
much,
say
sir.
God bless everybody.
Thank you so much. Thank you so much, Mr. Smith Tokunbo. We really appreciate you for this great, information that you have given on the accessible and affordable healthcare services utilizing technology, governance, and society. These are very, very important aspects that we really need to understand. We know without governance, without society, technology may not be able to thrive. And this is one of the key points that you have really made known to us. Thank you so much once again for that wonderful presentation, sir. And we hope we stay at the background while the questions, will be forwarded to you. Thank you so much, sir, and have a wonderful day. Now, I want to quickly